What's up, everybody? It's your main man, Big Ive, the talk of the town, Mr. DETVCH.com, Mr. Positivity. And today on Good Morning Wilmington, I have another special guest for you. And a friend of mine reached out probably about 3 weeks ago and said, "Hey, Ive, I need you to bring this story to light. There's a lot going on because of COVID, but there's a lot going on that people don't know about." So with special with amazing people like ChristianaCare that allowed that I'm able to have this conversation. I wanted to introduce you to Dr. Amara from ChristianaCare. How you doing, Doc? How's everything?
I'm doing great. Thanks, Evan. Thanks for taking time to interview me.
Oh, thank you. Thank you for your time. So it was brought to my attention that because of COVID-19, there are a lot of doctors that's in Delaware that's scared to go to work. They're scared to practice. Can you tell everyone why?
Well, the risk is there because this is a new virus, and healthcare frontline workers are at higher risk than ordinary people. But for some of the physicians, it's not just the health risk we are worried about, but we are worried about if something happens to us, our family members could be leaving the country. So I would like to talk a little bit about this. So we are on immigrant H&J visas.
Mhm.
What a J visa is almost like we are like 200,000 physicians according to American Medical Association we have in United States, and of those 50,000 are from Indian subcontinent, and then of those 12,000 people are on H&J visas, which are working visas. So
Right.
what J visa is that these are educated non-U.S. Medical physicians who come to this country for training. They're essentially trained in America, and they have to go back to their country after the training. But Conrad 30 program is a program which was established in 1990s for specifically for these doctors if they work in a J1 waiver area as directed by the State Department. So they have 30 positions for these kind of physicians who can work in a health shortage area or a medically underserved area. For 3 years, they are allowed to immigrate and work as a physician in the United States.
Mhm.
That entails the Conrad 30 program, which has been authorized every 3 years for the last 20 years.
Mhm.
And recently, Conrad 30 and Physician Access Reauthorization Program has been, we added new language to that, allowing physicians who are working on J and H visas who have served already for 5 years in the underserved area, health shortage area,
Right.
to exempt them from all the cap bills, all the country caps, and let them proceed for immigration.
Right.
Um, so what happened with COVID is things got even worse. We are at the front line, and we are physicians, and some of us are getting sick. They are taking time off because of sickness, because of
Right.
quarantine. We need coverage at the front line too. So all these physicians who are working cannot go and help in another state because of work restrictions imposed on J and H visas. So they cannot, even though physician licensing barriers have been removed, they cannot go and have direct access, patient care access, or they cannot provide telehealth services in another location not specified in the visa. This bears not only that, this bears heavily on the, if something happens to these doctors, and unfortunately, if a bad thing happens to them, their family will be deported back to the country, out of the country. So this
So wait a minute, Doc. So what you're telling me is that COVID-19 comes, the doctors are like, if they catch COVID-19, the whole family has to be deported. Now,
Well, if something happens to them, let's say
yeah,
something bad happens to them, the family who are dependent on that physician have to
right,
leave. They do
right,
not have any protection.
and even with that, there are a lot of doctors that are in the Black and brown communities, the underserved communities. So they leave, it leaves it wide open to just run rampant. But the families of the doctors, wow, wow. How are you holding up?
It's difficult because I am doubling my risk every day because ours is a physician family. Me and my husband serve in hospitals, and we are doubling our risk, and we are afraid, very afraid. Not that we don't want to take care of patients or not that kind of concern, but if something happens to us, what will happen? So we have our, I mean, like, I honestly feel that we keep all that aside and we continue to serve the patients and communities. But at this point, I think we should bring this topic up. And, there are a lot of physicians like me. It's not just me. There are 12,000 all over the country. And we reached out to all of them, and we try to reach out to the congressmen and senators and ask them. And we have also asked help from American Medical Association. And they have drafted bills, which is what I talked to you earlier about, S948 and HR 2895, which will help in this process in the long run. Doctors from, if they've worked already in underserved areas, exempt them, and their families have some protection. Well, what happened with the COVID crisis, things got really, really short. And I have reached out to all the, including me and other physicians, have reached out to a lot of people, and American Medical Association, American College of Physicians, Society of Hospital Medicine, they have given us guidance. And the new bill, which is Healthcare Workforce Resilience Act, which was introduced recently by Senator Coons, who has championed this. I'm thankful for the support I've received from his office and him personally. I would like to thank him. He has championed this bill, and he introduced, last week it was introduced along with Senator Perdue, Senator Durbin. This bill actually helps in a short period of time to capture the unused visas, which were unused visas from previous years, so that 15,000 physicians and 35,000 nurses can use them during this crisis.
Wow.
So that helps.
Yeah,
That really helps this shortage. Not only for physicians and nurses who are getting sick and have to stay at home, quarantine, but also for their family members, it helps. So this is a short fix for the issue, but on a long run, we definitely need some solid legislation like S948 and HR 2895 to proceed and get approved immediately.
Yeah, immediately. Yeah, I remember when I got the call about 3 weeks ago. I immediately called over the Chris Coons's Senator Chris Coons's office, and I was telling the gentleman I was talking to, like, look, I got a situation in an interview, and I think you might want to see this. And so they asked for like all the information, and they said they was going to reach out. So I'm glad that they did. They did do that. Is there anything else you want the people to know? You want Congress to know? You want, say, Lisa Blunt Rochester to know that right now? What do you want them to know?
Yeah. First of all, I just want to make sure that we all practice safety here, not only for my personal sake, my health, for my family, for my patients, for my community. And I want to thank my hospital system and, all the people, senators and congressmen in Delaware people, for giving me an opportunity to serve Delaware. I also want to urge, and all of them, to write to your congressmen, write to your congresswomen, write to senators, that this is an important thing. This is not a partisan issue. This is a people's issue. There's a lot of deaths around, and we need to take this seriously and help us fight in the front line. Help us. So I need people to support me here and to help, so that I can help you guys. So that our economy will reopen and we can fight this COVID along with the people.
Yeah. Let me ask you this: how is ChristianaCare helping you out right now?
Excellent. I can't thank enough. They have been very supportive. I reached out to the leadership. They have provided enormous support. They have given us letters. They have helped us with reaching out to the senators, congressmen, and at federal level also. So I'm very thankful that I'm in a place called at Christiana, which has provided me this support for its
Nice.
physicians.
Nice. Doc, let's talk about real quick, like what could happen if a lot of the doctors in these black and brown communities, they're not there anymore or they're very limited. Can you tell like what type of devastation would happen in these black and brown communities, these underserved communities?
Well, you're seeing some healthcare disparities already in news, right, in black and
Yeah.
brown communities. And I'm sorry for that. And I say that because I have a lot of patients. I am very
Mhm.
close to these communities. And, it would be very devastating if we do not address this immediately, because
Yeah.
this crisis is not going to last a few months and just we'll have a normal lifestyle as we had before. This is
Right.
going to be there for another 18 to 20 months or maybe even longer. We don't
Yeah.
have a right treatment right now. We are still working on the treatment. We are still working on the vaccine. So this is not going away. So we need stronger support for the frontline workers. Also, AMA, American Medical Association, American Association of American Medical Colleges predicted that there's going to be 120,000 physician shortage by another 10 years. So we're
Wow.
going to make it worse. With this COVID and ongoing, already we were short, but
Hmm.
the COVID came and it made it even worse.
Right.
So those are the shortages we will be noticing in medically underserved communities,
Hmm.
black and brown communities, and,
Right.
Latino communities, and those kind of minority communities. So we will see that shortages impacting them more than others. But that's why because J visa, waiver visas usually are serving, those physicians are mostly serving in those underserved communities. So this becomes very important at a State Department level and, overall to serve in the rural and underserved communities.
Wow.
This
Doc, can you tell them?
legislation is very important.
So, and can you tell them that legislation that they need to pass again for the
Oh,
people?
they have to pass it immediately.
Right.
Pro- without any delays.
Yeah.
So yeah, and then keep aside everything else, and I mean like all the political issues, and this is for the common people. So
Yeah.
this is very important.
Yeah. Well, there you have it, Doctor. Thank you so much, and ChristianaCare, thank you so much for spreading this information. It's very important for the community. So there you have it. This is not a black or brown thing. This is not a white person thing, or this is a people thing. This can affect everyone. So call your politician, your governor, your senator. Call them now and tell them like, hey, we need to get on this because this right here, these are lives at stake. These are people. These are doctors that come to the country to help humanity, and now with this COVID-19, they'll be forced back, and their families will be forced back to back home, back to back to their country. Let's get on in front of this because this again is a humanity issue. Doctor, again, thank you so much for your time. I really appreciate you for coming on. Good morning, Wilmington. I'll check in for updates to see if you got anything else, so we can keep telling people what's going on. But I appreciate it. So this is your main man, Big Ive, the talk of the town, and I will be right back after these messages.
What's happening? I'm C. Brian Williams, founder of Step Africa, and I'm here in the basement with DETV.